Hello again and welcome to this discussion on the chest X-ray features of pleural effusion. This tutorial is a follow-up to our earlier tutorial on the interpretation of chest X-ray, where we had a general overview of chest X-ray interpretation. You may wish to refer to that tutorial to refresh your minds. Now, what is pleural effusion? Pleural effusion refers to the abnormal collection of fluid within the pleural cavity, which is the potential space between the parietal and visceral pleura. Effusion can result from a variety of causes such as heart failure, infection, malignancy, and trauma. Now, without wasting much time, what are the X-ray features of pleural effusion? We'll begin by comparing a chest X-ray with normal findings with another one with features of pleural effusion. The image on the right side of the screen is an X-ray with normal findings, while the image on the left side is an X-ray image with features of right-sided pleural effusion. Now, the features of pleural effusion include blunting of the costophrenic angles. This is the earliest sign of a pleural effusion, and at least 200 ml of fluid within the pleural cavity is enough to cause blunting of the costophrenic angles. For the right image, we can observe that the costophrenic angles are sharp and well defined. As for the left image, the left costophrenic angle is intact with sharp, well defined appearance. However, the right costophrenic angle is not clearly visible, with some opacification in that side of the thorax. This is called blunting of the costophrenic angle. Another X-ray feature of pleural effusion is homogeneous opacification. This refers to the replacement of the long markings by a uniform opacification in the affected hemithorax, as clearly seen in the right hemithorax on the left image. On the right X-ray, you can see that there is no opacification, with the long markings clearly visible. Another feature is the Meniscus sign. This refers to the concave upward margin of the opacification in the affected hemithorax. A typical illustration of the Meniscus sign is what happens to water in a test tube, as shown here. In cases of massive effusion, which could be under tension, the mediastinum may be shifted to the contralateral hemithorax. The silhouette sign may also be present. This refers to the loss of soft tissue borders of the heart and the diaphragm as a result of fluid collection. Remember that fluid has a similar density as soft tissue. Therefore, fluid collection leads to opacification, which obscures the borders of the heart and the diaphragm on the chest X-ray. As you can see on this chest X-ray, the right border of the heart is obscured, as well as the right hemidiaphragm. This is as a result of the opacification produced by the pleural fluid collection. On the lateral decubitus view, another feature called layering may be seen. This sign is helpful in detecting small free-flowing effusions and distinguishing them from loculated collections. In this case, the patient lies on their side for a decubitus film, and the pleural fluid will layer out along the dependent chest wall, as clearly demonstrated in this image. Now, what are the pitfalls that make interpretation of a pleural effusion challenging sometimes? We have, in cases of a loculated effusion, which is often seen in empyema and malignancy. Loculated effusions appear as biconvex or lenticular opacities that do not shift with position. It may mimic a long mass or consolidation, making the diagnosis of pleural effusion more challenging. Another pitfall is in cases of hydropneumothorax. This is a combination of air and fluid within the pleural space. In this case, there is usually a horizontal air fluid level on an upright film. This is unlike the meniscus sign that occurs in a pure effusion. Another pitfall is that it is sometimes difficult to differentiate massive pleural effusion from atelectasis or lung collapse. However, the secret is to remember that a large effusion usually pushes the mediastinum away to the contralateral hemithorax. In contrast, lobar collapse or atelectasis pulls the mediastinum towards the ipsilateral side. Now, let's briefly review a few chest x-rays with features of pleural effusion. So this is an x-ray with features of right-sided pleural effusion. As you can see, the left side of the chest in this image is unremarkable, with intact costophrenic angle, no opacification within the left hemithorax. The border of the left hemidiaphragm is intact, as well as the left cardiac border. However, on the right side, there is blunting of the right costophrenic angle. There is opacification in the right hemithorax with meniscus sign, and the right cardiac border and the border of the right hemidiaphragm are obscured by the opacification. This makes the radiological diagnosis of a right-sided pleural effusion. The next image shows an X-ray with features of left-sided pleural effusion, and these features include blunting of the left costophrenic angle, homogeneous opacification in the left hemithorax, meniscus sign, as well as the blurring of the borders of the left side of the heart and the left hemidiaphragm. The radiological diagnosis is left-sided pleural effusion.